Most people think words like addict or junkie just describe reality, that they're neutral, maybe even necessary, but they're not. Those words don't just describe behaviour, they assign value, create distance and justify control. And once something is labelled, the system no longer has to understand them, only manage them. So if the language itself is shaping how we see addiction, what happens if the problem isn't the person, but the words they've been taught to use? This is part 58 in the video series. I don't know what happened to part 56. It seemed to disappear, but that's my fault. So chapter 8 starts with a simple idea. Addiction isn't just shaped by substances or policy, and we've talked about that in some depth. It's shaped by language. Words like addict, clean, dirty, junkie don't just describe people, they define them. They turn complex lives into simple labels. And once that happens, judgment replaces understanding. That language feeds propaganda. From headlines to public campaigns, fear is repeated until it feels like truth. And the result is powerful. People begin to see themselves through the same words. So the myth of the addict isn't just created by drugs or law. It's built, reinforced and sustained by the way we talk. If that's true, changing addiction starts with changing the language itself. So this is the start of chapter 8, Propaganda, Fear and the Myth of the Addict, part 59, The Language of Blame. Language is the first weapon in any war, and the war on drugs is no exception. Words such as junkie, dirty, addict and user do not describe behaviour so much as assign worth. They collapse complex histories into a single label, turning biography into pathology. Once named, a person can be managed. The insult does the work of the policy. It transforms exclusion into moral duty. As Foucault showed, every system of classification creates its own machinery of surveillance. Naming a group as deviant produces the need to monitor it. The addict thus enters the same linguistic machinery as the prisoner or the pauper, catalogued, observed, corrected. In medicine, the terminology shifts, but the power remains. Diagnosis replaces dialogue. Classification replaces care. We talked about that in earlier section 47. The lexicon of addiction emerged from religion long before it claimed scientific neutrality. Language of fall, temptation and redemption was secularised in relapse, craving and recovery. Temperate societies in the 19th century described drunkenness as moral contagion. The drunkard was not merely sick, but sinful. When psychiatry absorbed this discourse in the early 20th century, it retained the tone, if not the theology. Addiction was reframed as disease, but still one demanding confession and surrender. The modern clinic inherited the pulpit's power to define salvation and to name the unclean. This moral vocabulary persists in contemporary health policy. Government white papers speak of getting people clean, implying that those who use are dirty by definition. The same logic underlies bureaucratic euphemisms such as service users, patients or clients. My partner said that's been changed recently to something even more ridiculous, but I can't remember what it was. And treatment non-compliant, people who refuse, resist or cannot tolerate or do not follow prescribed treatments. Each phrase extends hierarchy under the guise of compassion. As I argued in Practical Anarchy, linguistic hierarchy is the soft architecture of obedience. Once a word is institutionalised, it does the disciplining on behalf of power. Mass communication magnifies these effects. From the Reefer Madness films of the 1930s to the Heroin Screws You Up posters of 1980s Britain, propaganda has relied on reputation and disgust. Each new substance becomes the next plague, each user the next folk devil. In British tabloids of the 1990s, the word junkie appeared most frequently alongside scourge, threat and menace. Linguistic pattern creates emotional conditioning. Fear becomes reflex. Gillen's observed the same dynamic in US reporting on poverty. Racialised imagery plus moralising tone convert structural failure into individual blame. Addiction discourse follows this script precisely. The effect is measurable. Surveys in the UK Drug Policy Commission found that most respondents associated people who use heroin with danger or untrustworthiness, even when told that many were in treatment or employment. David Nutt's comparative studies demonstrate how such perceptions diverge wildly from actual harm data. Alcohol and tobacco, the most harmful substances overall, are not normalised through advertising, while psychedelics and cannabis remain demonised for symbolic reasons. The hierarchy of danger mirrors the hierarchy of class, the legal drugs of the powerful against the illegal pleasures of the poor. As Moncrief notes, psychiatrist categories reflect not nature but policy. They shift with economics, not evidence. The most enduring victory of this linguistic war is psychological. Long before the long intervenes, language infiltrates identity. Many users describe feeling dirty or weak years before seeking help. This internalisation transforms structural exclusion into self-hatred. Lincoln Fellan describes stigma as a process of labelling, stereotyping, separation and status loss. Addiction exemplifies all four. Once labelled, the person is marked as other. The mark justifies distance. Distance confirms inferiority. Shame thus becomes a form of self-policing. The addict absorbs the gaze of authority into their own conscience. Marte calls this the addiction to self-judgment. The cycle of guilt and relief mirrors the drug's own rhythm. Each relapse confirms a story. You are what they said you were. Recovery begins therefore not in abstinence but in linguistic defiance, refusing the roles scripted by stigma. The personal act of renaming becomes political. When people describe themselves as survivors, peers or participants, they rewrite power relations. Such renarration is what Section 52 described as open source medicine, healing through shared authorship rather than imposed narrative. Language also performs economic work. In political speech, addiction is a convenient scapegoat. It allows governments to moralise poverty while expanding surveillance. Thatcher's war on drugs, Reagan's Just Say No, and Blair's Tough Choices campaigns all relied on moral shorthand. As Alexander shows, addiction rates rise not with chemical availability, but with social dislocation. Yet policy continues to blame chemistry rather than capitalism. The language of crisis distracts from the crisis of language itself, a society unable to describe alienation without punishing it. The Portuguese decriminalisation experiment offers a counterexample. By replacing criminal terminology with health-based language, users become citizens in care rather than offenders. Portugal reduced overdose deaths by 80% within a decade. The shift in words preceded the shift in outcomes. Where stigma decreased, help increased. Conversely, in the US and UK, punitive language sustained both incarceration and relapse. Organised crime flourished in the semantic vacuum created by prohibition. Critical linguists have long noted that terminology shapes policy possibilities. Fairclough described how word choice limits thought. In drug discourse, abuse presupposes harm, dependence presupposes pathology, and clean presupposes contamination. This framing defines what can be imagined as solution. If drug use equals pollution, then only purification, detox, discipline, abstinence can count as cure. Room warns that even clinical guidelines unconsciously encode hierarchy through metaphor. The addict falls, slips or succumbs, but rarely chooses, explores or learns. The grammar itself denies agency. Keane and Fraser and Moore argue that moral language allows states to present coercion as compassion. Drug courts, compulsory rehabilitation and mandatory testing all rely on linguistic disguise. Punishment renamed as treatment. In this sense, the language of care functions as the new discipline. As discussed in Section 58, power today hides even benevolence. The friendly bureaucrat replaces the jailer, but both speak the same language. To dismantle this regime, one must begin with words. Anarchist analysis treats speech as commons, not a possession. Just as Section 48 argued that knowledge must be open source, so too must communication. Truth cannot belong to a department. Community storytelling, peer journalism and harm reduction zines already perform the linguistic reclamation. The Crackdown podcast in Canada and Release in the UK exemplify how people who lived it with lived experience are reclaiming expertise. In these spaces, testimony replaces propaganda. The addict becomes author, researcher and witness simultaneously. Festivals and harm reduction networks echo this shift. Welfare tents at free party sites and mutual aid clinics operate on conversation rather than command, their language stripped of hierarchy. Instead of clients, they speak of crew. Instead of treatment plans, they speak of check-ins. Such linguistic humility restores dignity to both sides of care. It demonstrates what Section 52 called care without command, the idea that responsibility can be shared without control. Reform must therefore be linguistic as well as legal. Journalists could retire words such as clean and dirty. Public health agencies could replace abuse with use and user with person. Lawmakers might adopt neutral terminology already tested in Portugal, Switzerland and the Netherlands, where person who uses drugs is standard in legislation. The effect is not cosmetic but structural. Every neutral word widens the space for empathy. UK law has yet to make this shift. Drug user remains the dominant legal term, and first-person language is largely confined to policy rather than statute. As Hall observed, hegemony persists not through violence but through vocabulary, the consent of the tongue. The war on drugs has lasted more than a century because its grammar is still spoken. Breaking the grammar is the first act of peace, but each reclaimed word, each refusal of insult, weakens the system that depends on them. Liberation begins when description becomes dialogue. The next section traces how this linguistic conditioning is reinforced by imagery. The posters, broadcasts, the public information films that taught fear as virtue. Before confronting those pictures, however, we must grasp the script. Every poster begins with a word. Every stigma begins with a sentence. The first task of recovery, personal and political alike, begins with speech. Addiction isn't just enforced by laws or substances, it's enforced by language. Because once a person is reduced to a label, everything that follows, stigma, punishment, exclusion, feels justified. Which means the real power isn't just in policy, it's in the words that make the policy feel necessary. So if the language we use is creating the problem, not just describing it, what exactly are we reinforcing every time we repeat it? And if that's true, it leads to something bigger, because the images that follow don't just repeat the words, they make them feel real. So next up, still in Chapter 8, Propaganda, Fear and the Myth of the Addict, is Part 60, Manufacturing Fear, Media as Conditioning.